We are at the FIP World Congress in Buenos Aires here with Dr. Kelly Grindrod. She is an assistant professor at the University of Waterloo in Canada. Welcome, Dr. Grindrod.
Thank you.
You spoke about privacy and security with mobile medication apps, as well as the feasibility of providing medication counseling using AudibleRx. Could you tell us more about how you're seeing medication technologies improve medication use today?
Yeah, so this is a new and emerging field. We had been seeing a lot of apps coming out. So something I talk about is that there's 164,000 mobile health apps out there. Most of them are focused on exercise. They're not really focused on medications. A very small subset of these apps are actually focusing on drugs or things that are really relevant to people who are actually living with chronic illness. So we're starting to see a shift with apps that were very basic, that weren't necessarily solving a problem patients had, but maybe gave them the ability to create a list of medications. And then now what we're starting to see is people thinking these apps through a little bit more, and they're starting to add in better features. So I think what we're seeing is an evolution in technology, where now the technology is actually starting to align better with healthcare, and we're seeing smarter apps, more effective, or apps designed to be more effective. We don't necessarily have research on their effects at this point.
With the emergence of more and more apps, what are your comments on the risks to privacy and security for the patients who are using them?
This is a big concern, and this was what we were talking about with our study. So when we looked in Canada at all the apps that help people manage medications for free, so not ones you're paying someone for, we found 184 apps, but only 70, or up to 70% actually didn't let patients have the option of putting a password on their app. So this is a list of their medications, and these are very, very sensitive. And we know from research that medication apps are actually considered the most sensitive of all health apps. So to have the most sensitive of health apps with no password option doesn't really make much sense. So there is a big concern here that if people are downloading them or being recommended to use these apps, they're going to put an easily accessed list of all their private information on their phone that anybody could just pick up and look at.
Bearing that in mind, what advice would you give to pharmacists who are recommending these apps?
Well, a big thing I think pharmacists need to start doing is that if we were designing these apps, I presume that most pharmacists or physicians or other healthcare people would recognize that privacy is important. So we know that passwords are important. We know that encryption is important. The ability to remotely wipe a phone if it goes missing with health information on it, we recognize that. So I think that pharmacists and health providers need to start communicating with developers better and saying, you know, for me to recommend this, I at least need to give my patients the option of securing their information with a password, for example. Or I need this to be encrypted, and I can't trust it until it's been encrypted. On the flip side, when pharmacists are talking to patients and recommending them, I don't think you can recommend an app with, you know, a MedList app for a smartphone at this point. You really need to say, why don't you try this app, but we should talk about security. Do you lock your phone? Oh, you don't lock your phone. Well, you should try turning on a password. These are conversations we should start thinking about having.
Do you believe that older or more vulnerable populations are going to be left behind with the emergence of these technologies and as they continue to expand?
So it's not older, but it's more vulnerable people. So people who, when we talk about the digital divide, it's not older people, it's older people who have lower education or lower income. Those are the people who get left behind the most. And yeah, when we talk about technology, we often talk about the unintended consequences of technology. So introducing a new technology, e-banking is a great example of this. It really did put pressure on people who maybe didn't have the stability to use e-banking when countries started introducing this. So we will leave people behind. But in healthcare, which in the country I'm from, it's public, right? It's publicly provided. We need to be very careful that we don't start moving to technology that leaves behind those most vulnerable, because we're responsible for them as well. So that needs to come from within the healthcare system.
Could you tell us a little bit more about AudibleRx?
Yeah, so AudibleRx is a cool website. My grad student found it when she was doing work on low health literacy populations. So the idea is this, Steve Lewick has this website, AudibleRx.com, and he has a list of over 200 these podcasts, these audio recordings, about 6 minutes each. They provide information on drugs. And we love the idea that patients could take these podcasts home and they could look them up, they could search for them, they could Google them, and they could listen to a pharmacist talk about a drug who's not necessarily their pharmacist. So they would see their own pharmacist or their own physician, but here's other information, additional information online. The problem was it had some jargon and things like that in it. So what we did as academics is we worked with them to come up with a more health literate friendly podcast. And so he's actually tweaked it and he's changing at the website. It's actually launching this week, so you can check it out. They're trying to make it a bit slicker and more friendly to people. So this goes back to leaving people behind. One of the things we can do is design these tools to be inclusive of people who are more likely to struggle with health literacy, for example. And we as academics and pharmacists can reach out to people who are developing them and to kind of show them how they can do that.
That's great. Thank you so much, Dr. Grindrod. We really appreciate your time.
Thank you.
This is Laura Lorenzo reporting for FIP.